Hello, welcome to Health Check, a program designed to help you maintain optimum health. I'm your host, Renita Shelton with the East Point Fire Department.
And I'm Kipling Primus with the Fulton-Dekalb Hospital Authority. Today we're going to discuss the issue of heart disease. According to the American Heart Association, more than 16 million Americans aged 20 and over are living with coronary heart disease. Heart disease remains the number one cause of death in the United States. It is the leading global cause of death, accounting for more than 17.9 million deaths in 2015, a number expected to grow by over 23 million by 2030.
And to help us get a better understanding of heart disease and how to maintain a healthy heart, we have with us today Dr. Forrest Toka, a leading cardiologist with Total Cardiology of Atlanta. Dr. Toka, thank you for joining us. If you would, before talking to us about what heart disease is, let's talk first about how the heart works.
The heart is generally a pump, and the heart pumps out the oxygen in the blood to the rest of the body. And so the heart is really crucial in maintaining our health by providing that oxygenation to the different muscle tissues, to the brain, to the liver, to the kidneys.
What is the correlation between blood pressure and heart disease?
Great question. We hear a lot about blood pressure and high blood pressure and sometimes low blood pressure in patients. And really, high blood pressure is an epidemic in the whole country. Really what happens is that there's an optimal range for our blood pressure. We think of a normal blood pressure as 120/80, but an optimal range is less than 140 and less than 90 for the bottom number. When blood pressure goes out of those ranges, where blood pressure is high, can cause very dangerous effects. It can cause heart attacks, it can cause strokes, it cause a lot of other problems related to the whole body. And so it's very important that we do all the things to maintain our blood pressure in the right range. And sometimes that's diet and exercise, and sometimes for some people that's medications.
And what are the signs and symptoms of a heart attack? Classic signs and symptoms.
That's a great question. A heart attack can appear in different ways, and the classic description is someone who feels pressure in the chest, which may radiate to their left arm, may radiate into their neck. They may feel short of breath and sometimes have things like nausea and vomiting with it. But in general, those are sort of the classic symptoms. What we've discovered over time is a lot of people, like women and diabetics and other people, have slightly different symptoms, and that what we originally looked for many years ago in the studies was really looking specifically at a small group of people, namely males, and that by looking more closely at other groups that these symptoms can be a little bit different.
So when you talk about maintaining a good blood pressure for heart health, what are some of the things that you can do to maintain a good blood pressure?
That's one of the most important things. The first thing is knowing your blood pressure. So many times we avoid the doctor, avoid checking our blood pressure, avoid doing those things, or notice that our blood pressure is high and don't follow up on it. One of the most important things we can do is really follow up on our blood pressure and know our numbers, know our blood pressure, so that we can really follow that. The second thing is really a healthy lifestyle. And that's one of the most important things that we do is really a healthy lifestyle. So, making sure that we're pursuing a healthy diet, avoiding the fried food, so avoiding the fast food, avoiding adding salt to our food because there's already salt in the food. We don't want to add additional salt, avoiding a lot of sugar and desserts, and then trying to make sure we're eating a lot of vegetables.
And we know that stroke and blood pressure, there's a connection there. So if you could talk to us about that, what is stroke and what are the indications that a person is having a stroke?
Excellent. So a stroke happens for one of two reasons. A stroke, just like a blockage in the vessel to the heart causes a heart attack, a blockage in one of the vessels to the brain causes a stroke. So a stroke can be caused either if a clot goes to the brain, either from the vessels or from the heart, and if that clot goes to the brain, that can cause a stroke. And that's cause lack of blood flow and really the death of that brain tissue. The other possibility is, especially in the setting of high blood pressure, that the vessel can rupture and there can be bleeding into the brain. So either one of those things can cause a stroke, and a stroke, as we all know, can be very, very serious.
And how quickly should someone respond or get help if someone is near for a stroke, a person they suspect is having a stroke?
One of the most important things is if you at all suspect a friend or a relative or a family member is having a stroke, is as quickly as possible to bring them to a hospital, because the treatments for stroke, there are much better treatments in a short period of time after the stroke starts. And the time from when the stroke starts in terms of what treatments are available is very, very important. And so I would say as soon as there's any sign, sometimes it can be, a facial droop, sometimes it can be loss of function of one side of a person's body. Any of those signs, I'd immediately bring a friend, family member, or person to the hospital to be evaluated.
Now, Dr. Toka, you are a cardiologist.
Mm-hmm.
Could you share with us who needs a cardiologist? What kind of patient should go to a cardiologist? And, share with us some stories, if you can, of your patients.
I mean, I see a very wide range of patients. And so I see patients who, at their sickest, I see patients who have defibrillators and devices to protect them from very dangerous heart rhythms, like what you see on TV when people have to be shocked with the paddles. So I see patients who are at their very sickest with very weakened hearts and that type of thing. Then I see patients who have a family history of heart disease, on the other side of it, who maybe not have had any heart symptoms themselves, but have a very strong family history of heart disease and are preventively, with preventive medicine, are worried about the possibility and trying to modify their cardiovascular risk. And so I see both spectrums of patients, and both are very, very important.
Is there an age thing? If you're 40, check with a cardiologist. If you're 29, you're good, don't worry about it? Or
I think my youngest patient is 17 and my oldest patient is 105. And so I would say if you have concerns about your heart, if you're having symptoms, if you have high blood pressure, diabetes, high cholesterol, a strong family history, if you have things like that and you have risk factors, it may be something that you need to see a cardiologist. I would talk with your primary care doctor, but certainly if there's any concern on your part or on your primary care doctor's part, you should see a cardiologist.
That's really concerning. Youngest patient, 17. So heart disease does not discriminate.
Exactly. I think we have in our minds, I think a lot of times what's promoted in the media or what we think about is, sort of a very specific certain group of people we think of. Sometimes people think of men more than women. Sometimes people think about older people more than younger people. And heart disease does not discriminate. We're all at risk for heart disease, and we all have to do the things to prevent heart disease.
All right, well, let's talk about how do we avoid a lot of this from happening, and that is maintaining a healthy heart. So can you give us some tips, some do's and don'ts to do that?
And we talked a little bit about the healthy diet, which is extremely important, because a lot of the things that, if you just go out to a local food, restaurant, a local food place, a lot of the options are not the healthiest options. And so sometimes one of the realizations is just to say a lot of the things, like you have to be an active participant in making sure you have a healthy diet, that a lot of the things that are available routinely are not healthy choices, the fried food and the salty foods and that type of thing. The second thing is exercise. Exercise is incredibly important. And exercise, we talk about, has two components. One is sort of, we think about, some people will say, I do a lot of walking at work. And so we think about the total number of steps you do per day. And so sometimes on our phones or on our watches or even just with a pedometer, a little monitor that watches how many steps we do, we can look at how many steps we do per day. And for each of us, we should set a goal of the number of steps and say, I want to do 5,000 or 10,000 steps per day, and set a goal for the number of steps. But in addition to that, that's not enough. And so in addition to that, we want to do a certain period of time, at least 3 times a week, get that heart rate up, get the heart stronger. Just like lifting weights builds your biceps, we want to do something 3 times a week that gets the heart rate up and gets the heart stronger. And that can be walking, that can be running, can be swimming or water aerobics, can be biking, any of those things. It could be walking in your house. It could be, I have a patient who walks up and down their stairs, in their house. And so whatever it is, finding some activity that will get the heart rate up, get the heart stronger, and doing it for 10, 20, or 30 minutes, at least 3 times a week.
Wow.
Dr. Toka, you've mentioned several times about knowing your numbers. You've given us the numbers for blood pressure. You've mentioned watching cholesterol and weight and the intake of food. What are those numbers that we should know, and what does it mean to know the numbers when you can kind of talk about your health, with a cardiologist or with your primary care physician, because you already kind of know what's going on?
Right, and we've reached a time in medicine where I think we all have to be our own patient advocates, and we have to be responsible and involved in our own healthcare and make good decisions for our healthcare. And so one aspect of that is knowing your numbers, is knowing about you as a person. You certainly know your symptoms better than anyone else. You know what's happening with your body more than anyone else, but you have to know the numbers in addition. And some of the numbers that you mentioned are the exact most important things. And so knowing your blood pressure, so checking your blood pressure at the pharmacy or the fire station, or if you have a blood pressure cuff at home, knowing your cholesterol, and the cholesterol is broken down into the total cholesterol and then into good and bad cholesterol, and having some sense of where your cholesterol is important, because I have a lot of patients who are extremely healthy but don't necessarily have a good cholesterol because of genetics and other things. And so really looking at, knowing those numbers. In addition to those, if you're diabetic, there's a long-term blood sugar measurement, which it's important to know, called the hemoglobin A1C, which is just a long-term measure of your blood sugar. So instead of measuring it for at that moment, it tells you what it is over 6 weeks to 3 months. And so knowing those type of numbers, and if you're a heart patient, knowing the squeezing of your heart, which is called the ejection fraction, trying to know as much as possible from your doctors about what's happening with you and what's happening with your heart and your blood pressure, as well as your blood sugar if you're diabetic.
So we know the takeaways for today. The main thing, diet, exercise, and knowing your numbers.
Yes.
Thank you, Dr. Toka. Thank you for joining us, and we thank you as well for joining us on our first program, and this will be a monthly program, and we look forward to seeing you next month.